Welcome back, folks. Tens of millions of Americans are battling prolonged periods of pain, what's called chronic pain. About 1 in 5 U.S. adults experience this sort of life-altering condition, according to the CDC. It not only takes a physical toll, but a psychological one, too. Here to discuss what can be an invisible burden is Scripps News Tonight medical contributor Dr. Omer Awan. Dr. Awan, always good to have you. How exactly is chronic pain diagnosed?
Well, it's tough, Christian, because as you know, pain is extremely subjective, right? You often, if you go to a doctor will often ask you, well, rate your pain on a scale from 1 to 10. Well, 1 for one person can be 10 for a different person. And we know that everyone individually experiences pain very differently. Groups of individuals and demographic groups of individuals experience pain very differently. So this can obviously be very frustrating for a physician who's trying to diagnose pain. It can often lead to skepticism. It can lead to a source of anxiety, even for patients that may feel that they're not getting appropriate therapy from their physician for the pain that they have. So it is extremely difficult to diagnose pain because it is literally so subjective, very subjective.
Yeah. Let's talk about that subjectivity for a moment. How exactly should people go about assessing their pain to know whether it is above a normal threshold?
I think that comes from everyone individually. I think we know what we can tolerate. Different people have different levels of resiliency, but certainly we have something within us that lets us know that something is not right. And, normally we can go through our day, like a normal routine, but when something doesn't allow us to do the normal functions that we can normally do, normally if we are going to work or if we're playing sports and we can't do that function anymore, that is a cause for concern. And that's when you really should seek medical help, medical attention, and communicate that effectively to your physician. I think the more communication there is, the more transparent it is between you and your healthcare provider, the better it is for you and the better you'll be diagnosed, and hopefully the better therapy and treatments you'll get to hopefully alleviate that pain. Because as you know, it's a serious problem. And we're talking about more than 50 million Americans that experience this type of chronic pain every year.
Yeah, and something we both know is that, there is debilitating pain, right? But it shouldn't have to get to that level before you go seek medical attention. That is just one way to really think about that pain threshold. Beginning in the later 1990s, there was an uptick in U.S. doctors prescribing opioids to treat pain. Since then, physicians have cut back on prescribing opioids due to patient addiction and overdoses. Are opioids still a good option to treat chronic pain? And if not, what other options are available?
Well, it's certainly an option, Christian, but we have to be very careful when we prescribe opioids because still opioids and synthetic opioids specifically are the major cause for opioid-related or drug overdose deaths. More than 2/3 of opioid or drug-related overdose deaths are a result of synthetic opioids, particularly illegally manufactured fentanyl. So, we have to be very careful as physicians when we prescribe opioids for this very reason. But there are many ways we can treat pain, not just through medications, but also surgery. Physical therapy is something that's very important that we often don't talk about. And even we need to be a little bit more creative because it's such a big problem. I mean, it's literally an epidemic. We have to think about things outside the box, things like yoga, acupuncture, meditation. These are all great ways to deal with pain because, as you know, pain is not just physical. It has a mental component to it. It has a behavioral component to it. We have to, really adopt a multidisciplinary approach where we, tap into all those things, not just the physical aspect, but also the mental aspect, the behavioral aspect as well.
Yeah, with the last 30 seconds we have left, Dr. Awan, you mentioned this just a bit ago, alluded to it at least. What exactly is that relationship between chronic pain and mental health? Something for our audience to really think about here.
Well, I think it can result in a vicious cycle. 85% of people that are depressed experience chronic pain, and then it can often lead to a vicious cycle where people are, if you're depressed, it can, it augments some of these physical symptoms, and then that can make you more depressed, and it just kind of leads to this vicious cycle where one leads to the other, and it often results in like the chicken or the egg. We don't know which one comes first, but we do know that there's an intimate relationship and association between the mental aspect of pain and the physical aspect, and it's a very important point that we often disregard, even as physicians, when we're treating patients.
Yeah. Two things Dr. Awan said here, folks. Communication is key, and then think about the other options to treat that pain, whether it be yoga, acupuncture, meditation, whatever. Scripps News Tonight medical contributor Dr. Omer Awan, thank you, as always. We appreciate it.
My pleasure, Christian.